Hello and welcome to the Global Amateurs Podcast, the place where we will explore the mindsets, motivations, and methodologies of international relations. I'm your host, Salsabila with Ainie, and today we're going to talk about war against COVID-19 in Syria. We will discuss the ins and outs of Syria's struggle to fight COVID-19 and offer listeners a special surprise at the end. Be sure to listen all the way through for the details. Before we start, we would like to apologize in advance if the issues discussed are somewhat sensitive. The topic we discuss is based on information from credible news media, and this is for our academic purpose. We don't have any intention to offend or giving bad views of the parties we mention throughout our conversation. Thank you. Okay then, Ainie, you can start first.
I will talk about the beginning of the spread of COVID-19 in Syria. This pandemic arrived in Syria relatively late than other countries, but it spread rapidly in Syria due to certain factors that they can avoid. The situation has led President Bashar al-Assad to close the border and some high-risk public areas since March 2020. What is even more shocking, the number of coronavirus cases that happen in Syria is higher than the number of the case report in the mass media. Maybe we will think about this, how this can happen. The data must be the same as the actual case, right? Actually, many of Syria's citizens refuse to go to the hospital when they find they are symptomatic. Why do they not want to get the treatment? I think the real worst problem they face is poverty and hunger. So they believe that COVID-19 is not an important threat when compared to their life hardship.
Yes, it was all because they also struggled with many conflicts, such as war and then suddenly COVID-19 spreading worldwide. Many refugees in camp cannot afford masks because, like you said before, the problem is poverty.
I'm pretty sure that many of us don't know about the real problems they have to face to fight the coronavirus from spreading. But they have no choice. They have to deal with the placement problem that make it difficult for them to obey the social distance. I think I need to hear about it from your view, Salsabila.
I think the country must be responsible of their citizens. They cannot fulfill their needs because of the current unstable situation. Coronavirus is real. It spread rapidly, and from the citizen or refugees' perspective, it seems hard for them to keep distance with each other, considering there are a lot of people in camp.
A little unfair to them. Camp is where they live, where they take refuge from the cold. But by living in a crowded place, they would carry the risk of COVID-19 to spread. What other option do they have? I think they have no option, no choice, nothing.
From the situation, they also cannot get enough water supply. They will find it hard to take good care and hygiene for themselves. The lack of a water supply makes them hard to shower, and they cannot wash their hands to protect themselves from the virus. It becomes more difficult because Syria has limited access to health.
I agree with you. The health supply is less quality besides the declining supply of medicines. What is sadder is the health professionals such as doctors choose to run away from the area. Some health professionals were injured and killed during the attack. Just like the hospital, 40% of health facilities were damaged and destroyed during the attack.
This will lead to difficulties in treating and preventing COVID-19 transmission in Syria. According to the World Health Organization, only 50% of hospitals across Syria are fully functioning, 25% are partially functioning, 25% are not functioning at all. But that is not enough to fight the coronavirus at a time when the number of people exceeds the facilities provided. According to World Vision, the COVID-19 case in northwestern Syria will continue increasing per month.
I would like to give an example of the limited health access in Syria at Al-Hol camp. This camp is the refugees camp and located in eastern Syria. The health facilities operation was suspended in August 2020 at this place due to a lack of personal protective equipment.
Yes, I know about it. From 65,000 people, a total of 35,000 were infected with COVID-19, and the majority were children under the age of 5.
There has been a sharp rise in the news of deaths and people falling ill in Syria. Although the official number of COVID-19 cases on August was around 847 and 463 from them is from Damascus. This seems to be in stark contrast to the situation in the fight. But I think the actual number of the case and deaths may be much higher than the recorded.
The estimate is based on an assessment from the funeral office, which shows an average of 800 deaths in 8 days in Damascus, or about 100 deaths per day.
Amnesty International also has been told that Syrian public hospitals have to turn away patients due to the lack of beds, oxygen tanks and ventilators. There are also residents willing to rent the oxygen tanks and ventilators for the high fees. This does explain that Syria has the limited access to the health care.
A total of 193 health workers were confirmed positive for COVID-19, and I am sure that the number is higher than recorded. 11 health workers are declared dead because of this virus, but the Syrian Doctors Union reported that a total of 61 health workers had died from the coronavirus in August 2020. Because of this, health staff is relatively limited in Syria.
Did you know that many Syrians said the COVID-19 problem is not as severe and comparable to the issue they have to face? For them, strikes, trauma and poverty are the real problems and the real challenge they need to face. And I wonder, there is no party or agency that knows about these situations?
Actually, there are reactions and help given by certain parties to them. What makes the difference is that there are help delivered successfully and there are aid withheld.
Did you mean Islamic Relief and Save the Children?
Absolutely. I'm sure that you know about this. Islamic Relief was conducting to awareness raising in health centers. They were concerned about hygiene and health access when people were struggling to fight COVID-19. They have provided 84 pieces of health equipment such as masks, gloves, medical gowns, and so on.
I think I want to talk from a different perspective, but maybe this issue are a bit sensitive, sorry. As you mentioned just now, there are aid that cannot arrive at the Syria camp. Save the Children are the agency that also sympathize with the COVID-19 situations and they plan to provide the health supplies to Syrian citizens. Unfortunately, they are being stopped and prevented from channeling aid by the certain parties.
The issue here is, will Syria be able to deal with COVID-19? Ainie, just now you mentioned that most Syrians think COVID-19 is not a big problem as their main problem, but they also worried about this pandemic. Through the interview at Idlib camp, they tell about how they handle this. If there is an attack, they will hide in the cave, but coronavirus, they cannot hide anywhere to avoid this virus.
Yes, the situation is also getting worse when they need to against COVID-19 and the attacks at the same time. Many of them were killed, injured, homeless and be the victim of the violence. When COVID-19 comes, it can increase the pressure that they have, increase their suffering, how they want to fight the disease in the two difficult situations at the same time. Let's say they have the symptom of coronavirus or they are already infected by the virus. At the same time, the attack is ongoing. Can they go straight to the hospital for the treatment during the bomb blast or the airstrike? I think they cannot do anything. They have no choice.
They have no choice. When they are out, they risk being injured by an attack. When they hide, COVID-19 will spread rapidly and eventually may become untreatable. Sometimes I think about the impact they receive from the spread of the COVID-19 pandemic in Syria. Do they survive to live with the effects that they need to face?
Can you share your views on the effects of COVID-19 spread in Syria? Does it have an impact of health aspect as well, or change the political or economic landscape?
In my opinion, of course, the COVID-19 will affect the health of Syria. We also discussed it just now. I want to talk from the economics aspect. We all know that COVID-19 is destroying the national economy. Not only Syria is suffering, but other countries as well. Regarding from news, that Syria's economy was terrible before COVID-19 due to corruption, nepotism, and exploitation of natural resources. The economy in Syria getting worse when COVID-19 spread.
I see. The value of currency in Syria has also declined drastically, right? It fell about 90% from the value of the United States of America currency. They are also unable to manage their own natural resources, and I think it's quite challenging to develop the economy of their country. Which this, the problem of hunger and poverty that they have to face are difficult to overcome. That's why they said their pain is worse to compare to the COVID-19.
Then Syria also has a problem regarding food. As what has been said a moment ago, the Syrian currency has depreciated in the wake of the spread of the COVID-19 pandemic. This leads to an increase in food prices due to the problem of inflation that occurs. Very pity if I think about their condition. With poverty encountered, difficulty in obtaining COVID-19 treatment, now they need to face the problem of rising food prices.
Representative of the Dominican Republic also react to the situation in Syria facing COVID-19. According to him, food aid in the northwest is become more challenging to deliver due to high cost, high risk, and inflexibility with time. Why does this happen? The closure of the Bab al-Salam intersection was the cause. However, there is still a process of the food distribution through Beirut spot not disrupt at all.
Because you have said about other countries' views and reactions, what if we delve more into the opinions and suggestions that each representative of the country put forward to help Syria in preventing COVID-19?
Sure, I will continue my talk and my little information about this now. The representative of Vietnam also sympathize with Syria. In the face of war, they have to fight COVID-19. On resolutions 2020 in United Nations, he welcomed the measure to address logistical challenges in Northwest and called for increase the response of Syria's COVID-19 by providing technical assistance and medical preparations.
Representatives of St. Vincent and the Grenadines also said that cross-border assistance mechanism must be improved to provide rapid assistance to the Syrian people without risk. He also urged the parties to respect the ceasefire in the Northwest, given that all military and anti-terrorism activities must follow to the principles of armed conflict policy. This is because suppression of COVID-19 is very important.
Quite interesting. I can say that many representatives talk about this, and they also want Syria to be free from this pandemic and achieve peace and a good level of health.
I think our explanation about the cause, the situation, and the reaction to the war against COVID-19 in Syria is enough. Should we talk about the efforts and ways that might help Syrian citizens fight this virus?
I'm also think so. So let's move on to the next part.
What do you think about the suitable efforts that can help refugees which are affected by the situation?
From the medical perspective, medical servants in Syria said that the government must be transparent regarding the total case infected per day is increasing day by day, and they need to take urgent measures to support hospital and proper equipment for the medical servant.
Yes, I also hope that there are improvements from health and medical aspects. Moreover, in the facilities, Syria needs functioning health facilities for care and treatment, especially to detect COVID-19.
And don't forget about the health workers too. They are overwhelmed by these current situations. For example, in North Syria, out of 16 public hospitals, and only one is fully functioning and 3 are partially functioning.
Yes, I know. In May and June 2020, World Vision distributed 8,102 consumable hygiene kits to internally displaced persons in northwest Syria, and 39,117 individuals benefit from this activity. They get hand soap to encourage hand washing from World Vision. Do you remember that we have stated that there are camps in Syria, especially in the North Syria, experiencing water financial problems? World Vision also provides water tracking support to them.
They supply about 55,000 cubic meters of water during May and around 62 cubic meters in June. Sound interesting, right? This suggests that hygiene is very important in preventing coronavirus in Syria. The World Visions also give the money to support the newly displaced household that living in northwest Syria to support their needs.
WHO helps COVID-19 responders carry out heroic work during humanitarian crisis. Healthcare workers have played an important role in fostering public awareness of the growing threat of COVID-19, which is one of the most challenging parts of preparedness and response efforts in northwestern Syria. Healthcare workers have struggled to gain trust among the local community, especially convincing them to wear masks and practice social distance.
Their role is very important to fight COVID-19, and this shows that COVID-19 preventive measure in Syria has been carried out in a medical context, right?
China donates new medical supplies to Syria in order to against COVID-19. The aid raised and donated by a voluntary organization in the eastern Chinese province of Zhejiang includes face masks, protection suits, and ventilators, according to the Chinese embassy in Syria. The UAE has also helped Syria by providing food aid and medical assistance. The aid from the UAE comes as Syria is witnessing a sharp increase in coronavirus cases.
Sounds that a lot of agency, country and also organizations care about the struggle in Syria, right? Wait, I think we almost forgot to mention how sanitation was in the camp.
Oh yeah, what I've heard is the sanitation condition is, as we know, it's a public toilet which is used by many people. I worry if the transmission of COVID-19 also mostly happened from there. And what about vaccination progress in Syria? Under the COVAX facility, Syria is one of 92 countries eligible for advanced market distribution of the COVID-19 vaccine.
According to the news, Syria has signed on COVAX initiative to cover about 20% of the populations by the end of the year, but unfortunately, the first shipment of AstraZeneca vaccines, which was due in April, has been delayed at least till May. The delay in obtaining supply of COVID-19 vaccines dose to Syria is same like the other country. It is because the demand of COVID-19 vaccines is increased in India.
Under the COVAX facility in the first phase of COVID-19 vaccination, Syria is expected to receive 912,000 doses of the vaccine, including for the north of Syria, which accounts for 11% of the total Syrian population. An additional 224,000 doses of the vaccine will be allocated to northwest Syria.
Vaccine allocations in Syria is planned based on the latest population estimates by the United Nations Population Task Force. The target is to vaccinate around 20% of the population by the end of 2021, and health workers will be vaccinated in the first phase of COVID-19 vaccinations campaigns, and the elderly, people with comorbidities, school teachers and other key workers in the second phase.
After COVID-19 vaccine introduction, 200 independent monitors will be deployed by WHO and UNICEF in all governorates to evaluate the performance of the teams and the vaccination coverage rates. Just now, you mentioned about the delay of vaccines in Syria, right? Along with its partners, WHO will continue to fight the spread of COVID-19 in Syria and make all possible efforts to obtain a vaccine.
Human Rights Watch has expressed concerns over vaccine assistance to the people of Syria, especially people living outside the government area. There are refugees, internally displaced people, and asylum seekers, and most of them from northern Syria. So this organization is request to additional dose to assist such group in receiving the equal health rights. So both people in Syria can get the vaccinations.
Because access to the COVID-19 vaccine has few challenges in the Northeast, the UN Security Council has allowed the provision of vaccine assistance behind closed doors in the area. And although northwestern Syria still has an open border, UN agencies providing aid to northeastern Syria now rely on Damascus for deliveries and service throughout the controlled territory.
Suddenly, I want to mention about Turkish Cooperation and Coordination Agency, TICA. The agency has also implements various projects to prevent COVID-19 in northern Syria, which is this place has the high case every day. A total of 4 supplies production workshop and mass production workshop has been developed to contribute to help Syria in prevent the COVID-19. This agency also built many facilities, for example, a liquid soap production workshop and a surface disinfectant production workshop with cooperation with other agency to help Syria against the COVID-19.
The project aims to support citizens who have difficulty obtaining masks and are given some masks supplied from remote areas under challenging conditions in their efforts against COVID-19.
Do you have any ideas to add for the aid that can help Syria to fight the coronavirus, Salsabila?
Yes, I have. It's about COVID-19 infection prevention campaign in Syria. This stems from the hundreds of thousands of Syrians at risk of being infected with COVID-19 in northwest Syria. There are only 100 beds in the ICU, while the population is 3 million. Then, as a solution, this campaign was carried out to increase capacity in the prevention and cure aspects of the health sector.
I want to add the important help from the international organizations. COVID-19 most depressing effects when refugees and asylum seekers who lack facilities are forced to face the disease. This is because the territory they live medical access is limited. However, there are still parties concerned with this issue namely United Nations High Commissioner of Refugees. This organisation respond to impact of COVID-19 on refugees and asylum seekers.
This organization strives to ensure adequate personal protective equipment for health workers in refugee areas. They have provided masks and ventilators to upgrade the health facilities there. Cash assistance programs have also been put in place to assist refugees, families, and individuals who are experiencing income loss due to enforced quarantines.
I think we had talked about the war against COVID-19 in Syria for a long time today. In my view, Syria is the country that will find it hard to fight the COVID-19 pandemic in the short time because of their problem like placement problem. But it is not impossible to reach zero case if the effort to prevent this virus is supported by all parties, including the citizens, government, and also international organizations. So, Salsabila, what is your hope to Syria?
From our conversation, I realized that Syria government needs to give attention because they need to face two big problems, war and coronavirus. I hope Syria will often increase financial and medical support. This is what is central to COVID-19 eradication. The community should also be made aware of the importance of maintaining SOPs such as social distance, as there are various assistance given to them. For example, the provision of masks and water supply donations.
I would like to add a little of my expectations and also my hope to Syria, and maybe a bit sensitive to say, sorry, awareness to emphasize public life to avoid coronavirus need to be done with the full synergy and dedications instead of fighting the enemy, instead of the war. Because this pandemic that the whole world is facing right now is more critical and more important to face.
Ainie, maybe if you want to add something before we really end the podcast.
I have some word to say. No matter what happens, I know the people in Syria are mentally and physically strong people. When COVID-19 happens in Syria, they still can able to survive to their life. I hope all of the burdens they have to face will be ends, not only for Syria, but I also hope the whole world will be free from the COVID-19. Come on, we can fight this virus.
Okay, then, finally, we are in the end of our podcast. Once more, we apologize if we had mistaken during our discussion, and we don't have any intention to offend any parties. Thank you for listeners who stay with us from beginning until the end. Stay tuned and subscribe our channel to get more information related to COVID-19 in the context of international relations. Don't forget to watch next week's episode. Thank you and goodbye.